So the questions are, what are the chances of me getting pregnant after an abortion? What are the complications of an abortion? And also, if I've had an abortion, what can I do if I'm not getting pregnant? Good day, everyone. My name is Gwendolyn Hale, a seasoned and certified medical professional from the UK, and I'm popularly known as the medical professional with the difference because I bring you knowledge on health, medicals, and farming because I love farming and a lot more. And I do this like no other. If you're just joining this channel, don't forget to subscribe, to share, to comment, and to turn on the notification bell so you stay abreast with our new uploads and you'll be the first to watch. And remember, knowledge is power. If you're a returning subscriber, this is me telling you, je t'aime. Let's go there. Welcome back. In today's class, we are going to be answering the questions I mentioned earlier. I'm going into some details about abortion. Abortion is carried out in many communities around the world, and it has been banned in many communities due to political reasons, ethical reasons, cultural reasons, religious reasons, and what have you. But in today's class, I will be giving you the medical reasons why abortion isn't good, or telling you certain things that you should know around an abortion, or if you have had an abortion before, what you should do, or if you're trying to get pregnant, what you should do. Abortion is actually a procedure that is being done, a medical procedure that is being done to prevent a pregnancy. And this is being done in two ways, actually through a medical drug or a surgery. Hear this and hear this again. Postinor 2 is not an abortion pill. It is a morning after pill, a 24-hour pill that is being taken after unprotected sex within 42 hours. This medical drug which I'm talking about here must be under medical supervision because the weeks of your pregnancy needs to be determined before you are given this drug, and other health conditions need to be also supervised and actually followed up before this drug is being given. This abortion drug is being given. And on the other hand is the medical surgery that is being done by a suction pump, or actually by an equipment that actually scoops out the fetus. So that depends on the clinic you are in, and the region you're in, the country that you're in, the doctor that's in front of you. So wherever you're going for an abortion, please have this in mind. Personally, I'm not in for abortion. I am for pro-life. I know in some situations and in some countries, abortion has been banned for religious reasons, cultural reasons, political reasons, medical reasons. And in some other countries and communities, it's being practiced. But personally, for me, I am pro-life. I believe that even if the child has a complication, the child should be given to be allowed the basic human right to live until when God takes the baby's life. Don't use your hand to kill the baby. I know in some cases the baby is actually killed or allowed to die or aborted to actually preserve the life of the mother. But those are 2% or 3% cases. I'm not for abortions because of the mental damage it causes to women. You may not know it, but a lot of women who have aborted actually go through a lot of mental issues. They have mental challenges. It's not an easy decision to make. But when it is done, it's not something a lot of women can accommodate. Even when it's done under medical advice due to maybe that the child is deformed or to preserve the mother's life, you would see that the mother is inside shock for 2-3 years. You understand? Even though she has not carried the child. So whatever decision you are taking concerning abortion, at the end of this video, you will come to realize that abortion is not the best because of the complications that come with it. And I'm also going to give you some tips on what you should do if you've had an abortion and you're not getting pregnant, because abortion affects fertility in a long run. Now, abortion does not directly affect your chances of getting pregnant in the future, but it's the complications that come with abortion that actually affect your chances of having a child in the future. Now, when we are going into these complications, I'll give you a few. The first is mental health, I mentioned earlier. Many women cannot cope with that mental shock, and that disturbance in their mental health actually causes them to actually be infertile in the future. They find it very difficult to get pregnant again. It would take a couple of years before the lady will get over it and she'll be able to get pregnant. So it causes mental health. It causes a bad mental health. It actually reduces the mental health of a female. That's what abortion does. And even though it's a girl who has a child out of wedlock, she gets pregnant, when she's not married, this same mental health issue still plays in her life. The next is hormonal imbalance. Hormonal imbalance in the sense that, your hormones were already going towards you having a full pregnancy, and automatically that pregnancy is taken away. Your hormones are confused on what's going on. Something is not right, because your brain, your pituitary is telling your body something, but your body is not it's not going in line with what the pituitary is receiving, because there is no baby in the womb. So there's a lot of women experience hormonal imbalance, and it takes quite some time for a lot of ladies to get pregnant. Now, the third is infections. Infections can come from, let's say, if there are leftovers of the fetus in the lady's body and they are not taken out, and these infections could lead to pelvic inflammatory disease if not treated. If not treated in time, it would lead to pelvic inflammatory disease that may lead to scarring. And once you start having scarrings in your uterus, there is a problem. It may lead to infertility. Now, also, what could cause these infections? What if the equipment that they are using to scoop these fetus is actually not sterile? You're going to have an infection. And also, if you're taking the medical pill and for abortion, and you take this pill, and let's say all the fetus does not come out, you are going to have an infection. And if it's not noticed in time, you may have this pelvic inflammatory disease and maybe septicemia. That means the infection enters your blood and you may go into septic shock that leads to death. Now, what are the symptoms that you have an infection after an abortion? You have abdominal pain. You have a fever, a temperature, and also you have a funny vaginal discharge. So bear that in mind. Another complication that may lead, that may come from abortion is death. And as I mentioned earlier, this death will come maybe through excessive bleeding, maybe through an infection that may not be realized on time, and the lady may go into septic shock and she may go. Another point is excessive bleeding. The lady may bleed so much that she may lose her life. The bleeding may be so much. So think about it. The next point is the lady actually may spend more money into a second surgery, going into a second surgery, or going into a surgery if she's just taking the medical abortion pill, maybe because the fetus has not all come out, because there has been a fetus that has not been taken out, and this bleeding is because this fetus has not come out, all the pieces of the fetus hasn't come out. So she may need to pay extra money to go into another procedure of abortion. So we are looking about cost here. The next point is we are looking in the case of where there is a damage of the uterus, or the damage or the opening of the cervix. That is opening of where the baby comes out. You know, it has to dilate for the baby to come out. So there's to be a damage. You know, sometimes when you have these operations and different methods are being used in different communities, you have some people who actually use their hands, send their hands through to scoop out the dead fetus. They send out some equipment to bring out the fetus, and this may actually puncture your uterus or damage your uterus, and you won't be able to carry a child in your womb. But the only thing you may do is, since you are still producing eggs, you may only have a child through surrogate. That means you have a mother to carry your child, because your womb is damaged, but you are still producing eggs. Remember, I've always said, until you hit menopause, you are still a very fertile woman. You have eggs to get pregnant. The next point is ectopic pregnancy. In these cases, women who have had abortions, probably several times, mostly have ectopic pregnancies. And we all know the complications that come along with ectopic pregnancies. Most times your fallopian tube are going to remove, and a lot more. And you need to spend a lot of money to supervise a healthy pregnancy. So this is important, guys. Another case is excessive bleeding. We may get to a certain point where there will be excessive bleeding in the uterus, in a way that the uterus will have to be taken out, the womb will have to be taken out because of excessive bleeding. So bear that in mind when you want to go into having an abortion, because an abortion is not a very good procedure. Keep the child. And always bear in mind about the smelly discharge. I've mentioned the symptoms of how you know that you have an infection: a smelly vaginal discharge, you have a high fever, and abdominal pain. Now, I'm going to talk about a very important point: the Asherman Syndrome. The Asherman Syndrome is mostly caused from the scarrings in the uterus. And this is the main issue that causes a whole damage of the womb, of the uterus. That means constant abortion, several abortions actually cause these scarrings. And this scarring is where it ends. It causes infertility. Remember, pelvic inflammatory causes infertility. And some of the other complications that I have mentioned will actually lead to infertility. Asherman syndrome is the permanent symptom of infertility when it comes to abortions, because of the constant squeezing and scooping. And you know, after an abortion, you have a lot of pain, guys. So bear this in mind. Now, to answer the next question, what should you do if you have been trying to get pregnant after an abortion? What should you do? First thing I'm going to say, be honest to yourself. Go and see a doctor. You need help. If you're underage, be open about it. You know, there are many people who will go to the doctors, but they wouldn't tell the doctor that they are from having an abortion, or they have been taking an abortion pill and this is happening. They will make the doctor will be going around doing tests, but they know in their minds that they're just from doing an abortion, having an abortion, and these are the complications, but they are not open about it because they don't want to be stigmatized. Please be honest with yourself and put your life first. You know, I will advise you go with somebody who is older, because it will cost a lot of money. You need to run several tests so that it should actually be determined where the problem is coming from. You have to do a transvaginal scan, you have to do ultrasounds, you have to do some blood tests, to actually know if the infection has gotten into your blood. You actually do a couple of tests, abdominal scans on your pelvic, to see if there are anything. You also have to check if your ovaries are okay, if your fallopian tubes are okay. These are the tests that you need to check. And also, not only these tests, they also have to do a magnetic MRI scan to see if it comes out. If the problem is from your brain, you have to do all the fertility tests that have to do with a woman. And not forgetting your husband. Take your husband with you, because most times it's on the woman. You understand? But the men also have fertility issues. Take your husband with you and make sure that all these tests also are run. He does his own fertility test. He does his sperm analysis. He does a scan on his MRI to make sure that the pituitary is not interfering with his level of testosterone. It's not suppressing his level of testosterone. All these things you have to make sure you're not taking any form of steroids. Make sure if you're taking any medications, you and your spouse should let the doctor know, and I guarantee you will get pregnant. And if you're having any form of mental health after this procedure, after an abortion, you should actually meet a counselor, because most times these mental health issues prevent a lot of ladies from getting pregnant. So till next time, I remain your seasoned and certified medical professional, Gwendolyn Hale. Bye.